join. I really want to thank our speakers for this afternoon for coming. And I do want to recognize all our speakers that are here with us already. If you just stand while I call your names, while I call your organization's names. Ethiopian Global Initiative, okay, and the Society of Ethiopian American Engineers and Scientists. And we have also Saturday tutorials, I think we're still waiting on them. And the Redefined Life Center, okay, and Sister City of Montgomery, representative from, not here yet, okay. And we also have the host of this event, the Ethiopian Student Association International, and the Fragrant Foundation. Thank you. So if we just give a round of applause for all these speakers, I think before, so my task for this afternoon is to come up here and introduce all the speakers and presenters. But before I do that, let me just, I was asked to share my experience of the theme of this meeting, which is really community service and what it means and why we're here for this afternoon. You know, I remember about 6 years ago, my first experience for community service with Habitats for Humanity, and it was such an exciting experience because I was gonna, you know, help build a house. And we arrived that morning, I think, and you know, it was about 24 people, and we had a few donuts and coffee, you know, the usual thing. But by the end of the day, the entire house was finished. You know, when we arrived there, it was only the foundation. But by the time it was dark, you know, my friends were on top of the roof. They were basically helping to finish on that part. And you know, they were calling me and they were saying, you know, come join us on the roof. You know, we're almost finished. And you know, I have a picture, a sample of what that usually looks like. And as you can see, at that time the roof was not even finished. So, you know, I started to think, you know, what if I fall from there? And as you can see, it's like an incline, basically. And it looks very dangerous. And I started to, you know, look at my sneakers, and I started to walk around the perimeter of the house, just in case, you know, what happens if I fall from there. It was very scary experience. And after a while, I joined them up there, and what I wanted to share is basically the first time that I took the first steps on that roof, all the fear and doubt that I had was gone. And when I saw my friends just walking on this incline, it might not look that hard, but when you get on there, then I really got encouraged, basically. So I think this afternoon is not just about, you know, what we can do for these organizations, but I think it's also about what they give us, or as far as what they can do for us in terms of the kind of things that they push us to do. So, you know, as I was standing there 12 hours before where there was nothing, and now I was standing on top of this roof. So, you know, on any other circumstances, basically, if you probably see your friends on top of a roof, you know, you would call 911 or, you know, try to talk them down. But, you know, this afternoon is about special circumstances. And we're talking about things that really require extraordinary measures. If you see your friend on top of a roof like this and calling you, you know, asking you to help them build a house, you know, what would you do? Or even a better question is, what if that house is yours? What if that house is your home? I think, friends, we're here this afternoon because we all believe Ethiopia is our home. We have among us today community leaders that I just called, and they're asking us to help, to step up. You know, the Ethiopian community has too many holes, too many problems, you know, illiteracy, poverty, conflict, famine, just to call a few of the names that have become synonymous with the word Ethiopia. But then again, these community leaders are here and they're asking for our help. Because for us, Ethiopia means more. Because for us, we don't need to look up at references and dictionaries to understand what it means. It means our home. So I can tell you right now, the challenge that I will present to you and the things that I'm asking from you can be difficult, and they might even be dangerous. They can be difficult because you might have to give up a little bit of your time from your study, from your work, or social activities. And they might be dangerous because not everyone is going to agree on how you want to do things. Or perhaps you might even end up losing friends because of it. But just like that roof, this afternoon is really about conquering our fear and stepping up. Because if we don't do that, we stand to lose even more. We stand to lose our homes. So this afternoon is about restoration. And we know we have tough days, but only if we come to work together to fill these holes that are in our homes and in our communities. Despite all the tornadoes and the problems in the past, Ethiopia is still standing. And so this afternoon is the question, can we stand with her? Can we stand to restore hope, to give our hands, and to share our resources? So we join hands and join Ethiopia because together we can overcome these challenges that await our generation. So this afternoon is about saying we won't give up on our country, on our home, and on our community. So again, I welcome, and it's my hope that all of this afternoon will be productive, and all of these organizations are doing some amazing work, and they will be introducing their organizations. They'll tell us how they can get involved, how we can get involved, and what we can do to support their work. So without further ado, I would like to welcome Abel Taddese from Ethiopian Global Initiative. Abel Taddese is a native of Ethiopian, born and raised in Addis Ababa. He has a background in health sciences and high interest in global health programs and development. He has over 6 years of professional experience in healthcare, working in hospital risk management, environment, and managed care organization. Abel holds a master's in health degree with concentration in international healthcare. He currently leads the Ethiopian Global Initiative, or ESAI, Midwife Scholarship Fund as a project manager. Please help me welcome Abel Taddese.
Thank you for the warm kindness. Can I take this off and actually take that over? Salam dana walachu. How's everybody doing? I couldn't start our presentation in any way better than our friend has done, so I'm not going to start with emotional touch or anything like that. I was in the same situation where he was, where I started volunteering for Ethiopian Global Initiative. I was at a loss in the beginning, and I always wanted to do something back home, but I didn't know where to go. And so I started working and researching and looking. Thanks to our friend Google, you can do anything online, so just look it up, ask people, communicate to your peers, friends, colleagues, and then that's how I started collaborating with the Ethiopian Global Initiative. And they're young people, young professionals like ours, but they have great minds that we can use to build our country, Ethiopia. So, Ethiopian Global Initiative, if you don't mind pushing. I'll go over a couple of items. I'll overview for today. I know we are time limited, so about 5 points. I'll give you an introduction about Ethiopian Global Initiative, and then I'll give you some country indicators, which means why we're doing, why I'm involved with Midwife Scholarship Fund, and then local training, what we're trying to do back home, of course, and then how you can contribute as individuals, and then we'll conclude. I'll be here maybe 30 minutes afterwards because I know most of you guys probably ready to go and watch the Manchester United in Barcelona again later on at 7 o'clock, so I'll try not to hold everybody. And then we'll conclude. I'll be around in the back. I actually want to pass around our sign-in sheet, if you don't mind, just if you want to sign in. It has your name, organization, if you're a student, put student email and phone number, whichever you need, you feel comfortable putting. Okay, Ethiopian Global Initiative was actually started by Samuel Gabu around October 2006 in Cambridge, Massachusetts. When he started Ethiopian Global Initiative, it was under a different name, and he was 13 years old at that time. And the way the whole thing started is he watched Dr. Hamlin, who is the Fistula Hospital Foundation founder in Ethiopia, and he felt connected that he has to do something in regards to fistula. So he organized about 13 people and then actually sponsored 8 Ethiopian women back home to have a surgery in regards to fistula. What is fistula? Obstetric fistula is a tear between, I won't get detailed, but in the female area when they have prolonged birth. Prolonged birth meaning these women are having labor up to a week long or 2 weeks long. So that's really painful. And then when the baby starts coming down, that's when they have a tear internally. And then that's how Dr. Hamlin found the Hamlin Fistula Foundation back home, and she's doing free surgery to this woman. And then just to give you who we are, it's better to break it down with mission and vision rather than that statement. So I'll go to the next slide. The mission is to capture the social and intellectual capital of the students and professionals for better of Ethiopia. What does it mean? Let's collaborate together to deliver some outstanding work back home. Simple as that is. And the vision is to create and collect leadership to create sustainable development. You won't believe it, but we do have, Ethiopian Global Initiative has almost everybody's volunteers, from president to steering members or volunteer, lower level people are all volunteers. We do have offices in Canada, Australia, Europe, Ethiopia, and United States. Next slide. Okay, so what am I doing here? I'm the project manager. I do have a background in health sciences, and I'm also pursuing a certification in project management. So I decided to volunteer with Ethiopian Global Initiative as a project manager, as that is my goal, and I believe in education. So Midwife Scholarship Fund, we'll get into that, but let me give you a little bit of background in regards to midwives and why we need midwives in Ethiopia. What is a midwife? According to the International Confederation of Midwives definition, a midwife is a healthcare professional who has completed an educational program in midwifery and has met all qualifications to register and practice in Ethiopia. And these midwives in Ethiopia are actually community educators. They actually go out, not in a rural, Addis Ababa or surrounding areas, but they actually go outside where there is no healthcare education or access to healthcare facilities. Midwife provides care to women before, during, and after childbirth, which is very important, especially in the rural areas. Next slide, please. Okay, country indicators, these are just statistics. Of course, it may not be accurate, but we currently have a total population of 85 million in Ethiopia, and it's continued to grow, which is great, but at the same time, we have some problems that we need to address. And then out of 85 million, 83% are rural residents. That means about 70 million of Ethiopians live outside the city, where there is no healthcare access or anything like that. And then the women of reproductive age are, which is classified as 15 to 49 years of age, is around 20 million. And the number of maternal deaths that we've seen, and then this is statistics up to 2005 at 14,000. Neonatal care, neonatal mortality rate, meaning infants that after birth is about 35 per 1,000. That's a lot. And then stillbirth, that means baby that comes out without life, is about 26 per 1,000 births. Next slide. And then I do recommend you, on the bottom I did provide a source. It may not be hard, it may not be easy to see it, but stateoftheworldsmidwifery.com is a good source to kind of see what they've done. They have a lot of publications in there, so you can actually see what they've done. And then this is just a figure that I pulled from that source, where it compares the urban versus rural birth rates. And then as you can see, in 2000, the rural areas, about the people that actually give birth at home is more than 95%. At home, that means nobody is there to actually help them during birth. And then in urban areas, it's really not that exciting as well. It's really bad because it's below 30% that are mothers that actually go to hospitals or clinics that actually to deliver care. And it hasn't changed much. In 2005, in rural areas, still the number is significant where these women are actually giving birth at home. Giving birth at home creates a lot of complications on women and the child, as well as their long-term and short-term effects on them. Next slide. Okay, and then just to support the previous slide, as you can see, who attends birth in rural versus urban areas. As you can see, in 2000, again, more than 95% of women give birth by themselves. The light blue, or you can call it light green color, shows under the rural area. If you can, would you be able to point that on 2000? Yep. As you can see, no one attends birth, almost more than 95%, and then it's almost the same. So we're not seeing that much change in Ethiopia, and that's what we want to address. And then this actually goes hand in hand with United Nations Millennium Development Goals, and this is what what they're seeing in regards to the trend from 1990 to 2010 is really declining, and then we want Ethiopian Global Initiative and the Midwife Scholarship Fund wants to support them. And then, as you can see, 2010, about 470 maternal deaths out of 100,000 live births is reported, and then we want to cut that in half. Not we, but we want to support the United Nations and WHO, which is the World Health Organization. Okay, going back to Ethiopian Global Initiative and the Midwife Scholarship Fund, I want to point here real quick, even though the mission is to train 8 midwives at this point. We're shooting for 8 as a number at the Hamlin College of Midwives, and they are our partners at this point. And then the goal is to combat lack of skilled birth attendants and improve child and maternal health. And then I just want to point, the person in the middle in this picture is Dr. Hamlin. She's about 84, I believe, right now, and she's been in Ethiopia practicing and giving free surgeries for fistula patients for decades. And then on the right side is actually what's very interesting about Hamlin fistula is actually the way it works is when the patients go in, they get surgery. If they get better, they actually get trained by this hospital in college. And on the right side, she is actually, let me just pull out my cheat sheet. On the right side, she is, her name is Mamitu Gashe, and she is a fistula surgeon. When she actually went to that clinic, she was at age 14, and she had a huge fistula complication. And then right now, she's actually a surgeon, and she completed more than 1,300 free fistula surgeries in Ethiopia. And then in 1989, she actually received the gold medal from the Royal College of Surgeons in London. So that's kind of the effect that Ethiopian Global Initiative, Hamlin Fistula International is doing. They're actually taking the patient in, and then they're actually training them to become midwives, and then the midwives actually go to communities where they actually educate the women and then help them with their birth. Okay, again, just to repeat, I guess, the goal is to provide financial assistance, our Midwife Scholarship Fund, to students that pursue Bachelor of Science in Midwifery at the Hamlin College of Midwives. And the program is, of course, Bachelor of Science is four-year degree, but our scholarship program actually covers all expenses, including labor, clinical training, room and board. And then, I just say that. Okay, the potential impact to students directly is access to education with no financial burden. We believe at Ethiopian Global Initiative that access to education is key. It's better to prevent than treat. I always tell people that. So we don't want the mothers to suffer. And suffering and getting surgery, okay, that might be a good thing for the woman at that point, but in the long term, she has emotional and mental disability, and even we've seen cases where the woman actually with fistula actually is pushed away from her family. So that's what we're trying to avoid. And then a potential impact to communities is access to healthcare providers and educators in areas of maternal and child health, and support the healthcare infrastructure, especially the high demand of maternal healthcare in rural areas. Next slide. So overall, midwives do deliver healthy babies, and they provide care before, I'm sorry I missed a word, but before, during, and after birth, and then also they educate mothers in safe motherhood, nutrition, and family planning. I won't get technical here, but then overall our mission is to save lives. Okay, how to help? We have our website, ethgi.org. I welcome you to visit that website. You can definitely become a donor. You can definitely become spread, just pass the word to your peers, friends, or anything like that. And you can also volunteer opportunities. As I am a volunteer, I do invite everybody and anybody that will have free time to contribute with what they can. And then also, if you have a business or anything like that, we welcome partnerships with EGI. Just general pictures, students on top, and then on the bottom, Dr. Hamlin, of course, on the left side, and then a new midwife receiving her degree, and then in the middle, happy fistula patients. Next, please. There's one more. And then that's just my contact information, msf@ethgi.org, and then our website, ethgi.org/msf. And that's it. Thank you.
Thank you very much, Jago. Just to quickly recap,